In this latest research, I was interested in examining the degree to which people are aware of the type of skin cancer with which they are diagnosed. The two most common types of skin cancer are non-melanoma skin cancer and melanoma. And estimates of the prevalence of melanoma from self-report interview data interestingly differ from those from national prevalence data using large databases. So that suggests that some people may be unaware of the type of skin cancer with which they are diagnosed and report it inaccurately. So in this particular study, I used data from 2 years of the National Health Interview Survey, which is an annual health survey of the United States adults. Around 20,000 people complete the survey every year, and they asked questions about many issues, including people's history of a diagnosis of cancer. I was particularly interested in those people who reported a history of skin cancer, and there were around 1,000 of those individuals in the sample that I looked at. Interestingly, around 19% of those 1,000 people were not able to say whether they were diagnosed with non-melanoma skin cancer or melanoma. So I also looked at several factors that may be associated with people's lack of knowledge of the type of their skin cancer diagnosis. And interestingly, what I found was that people with a low level of education or family income had less knowledge of the type of skin cancer with which they were diagnosed. Also, those people who reported it being in poorer health or who lacked health insurance also were less aware of the type of skin cancer with which they were diagnosed. This is of concern for several reasons. First of all, it's been shown that people who have a lower level of education or income and are diagnosed with melanoma have a poorer prognosis for the disease. It's also of concern because it may suggest that people who lack awareness of the type of diagnosis may be less aware of the preventive health measures they should take in the future and screening efforts that they should undertake. In terms of take-home messages, for the patient, it's very important that they ask their healthcare provider about the type of skin cancer that was diagnosed, and also ask about the screening efforts and preventive health behaviors they can engage in the future. And for healthcare providers, it's important that they really ask their patients about their awareness of the type of cancer they were diagnosed with, and really verify that knowledge and ensure that they're aware of the preventive measures they should take in the future.